Because of COVID, many have put off in-person medical care for over a year.
In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker looks into why it's so important to get back into the doctor's office.
During the coronavirus pandemic, many of us became used to virtual appointments. Doctors say those are reasonable for the short term, but in-office visits catch problems that may not be found virtually.
During COVID, we did a lot of phone visits, but without a blood pressure check, without a blood pressure log, we were having difficulty adjusting medications because we didn't know what their blood pressure was.
Dr. Catherine Whiteley is a family practice physician for University Health. She says regular in-office visits as opposed to virtual visits are extremely important for older age groups.
If they're still driving is especially important, and so we try to get these patients back in every single year to make sure that their hearing is good, their vision is good, to make sure that they're mentally well enough, their reflexes are quick enough, they can do their get up and go test.
Physicians say they've noticed an increase in patients with weight gain, hypertension, depression, anxiety, and diabetes.
I've had a lot of patients come in this year having crossed that pre-diabetic borderline who are now diabetics, and we put them on medications.
All patients need to be caught up on all of their vaccines too.
We revaccinate for pneumonia, so the Pneumovax is very important. There's a new shingles shot called the Shingrix. That's a 2-dose vaccine. 50 and up is how we recommend giving the shingles shot if the patient has had a history of chickenpox. And of course, the annual flu vaccine. We are still highly recommending the flu vaccine.
Dr. Whiteley also says the best way to find out if you have a life-threatening illness is to see your doctor in person so they can check all of your vital signs to make sure everything in your body is operating as it should be. Jeremy Baker, KENS 5 Eyewitness News.
For more men's health information, call 210-358-3045. You can also find the rest of the Wear the Gown stories at wearthegown.com.